you posted on that. Well, do you have a phobia or a question about a psychological problem? We've got some help for you today. Our midday guest is Evansville psychiatrist Dr. Leonard Lotto. If you need some advice, now's the time to get it. Give us a call at 426-1414 or 800-832-0014. Dr. Lotto joins us now here in the studio. Dr. Lotto, good morning. Thanks a lot for joining us.
Thank you for the invitation.
You're welcome. We've got our first caller already. It's Mike. Go ahead with your question for Dr. Lotto.
Yes, Dr. Lotto. I'm just concerned about what if you have an elderly parent in a rest home, and they, want to get out real bad, and they want to leave every day, and they're very angry about it. What about would you like to keep them sedated just enough to where they're happy to be there, or what's the threshold on the medication, sir?
Well, it really depends on the reason that they're in the nursing home. If they're in the nursing home because they cannot be managed because they have a lot of agitation and they get out of control, there is a threshold to medicate. The problem with when you get older, you give medications that can over-sedate you. So in terms of a threshold, it depends. It depends if he's angry, if he's having a little problem with what we call reality testing. But I think it's enough to alleviate the anxiety. There is a right combination of medications that you can give a person depending on his medical condition and his psychiatric condition. But I don't think that, depending, I cannot speak for all the elderly patients, but I think it has to be the right dose so they don't fall and hurt themselves.
Okay. Hopefully that answers the question. Our next caller is Linda. Go ahead.
I have claustrophobia real bad, and I can't go through an MRI. And they will not put you to sleep to go through an MRI, and I need to conquer this to have a back problem solved.
Yeah, it sounds like it's a very painful situation, considering that you do need to get that evaluation. Claustrophobia is something that's treatable. Usually when you go into an MRI, I don't know if it's been considered, you can ask the radiologist to give you something to relax you. Usually they're very common and very safe medications. I can give the name of two. One is Ativan and the other one is called Klonopin. And that usually alleviates the fear and the anxiety prior to going into the procedure. And you don't have to go to sleep. The key is to give the medication at the right timing. So when you go in there, the anxiety is low.
Okay, very good. Sue from Evansville, go ahead with your question.
Hi, I have severe panic attacks.
Oh, yes.
And I've had them for several years. And I was wondering if there was any new medicine.
Oh, no. Yeah, you're not alone in this. In fact, it's become a very common ailment, and it's an underdiagnosed. It is easily confused with people with heart disease. People with panic disorder is very treatable. Sometimes you wind up in the emergency room so many times that they get confused with heart illness, but it really turns out anxiety. The most recent treatment with panic disorder is that a combination of what we call psychological treatment. It's a process where you desensitize, plus a medication. I have certain preferences, but there are many medications you can use, but there is one that is very, very reasonable, and it's called Klonopin. I don't want you to use this information to tell your doctor to give you Klonopin, but it is very helpful in combination with the psychological treatment, and there's an 85% treatment rate if it's done properly.
Okay, Fran is next. Go ahead with your question.
I have a friend who has a violent temper, which is being manifest more frequently than before. And I'm wondering, does it take more than one person to have someone committed to an institution?
Okay, it sounds like you're up against something real difficult, especially if it's a family member. The key thing is if this temper is a danger to somebody else and a danger to themselves, then somebody in the family or somebody that's close by may need to initiate some kind of action on their behalf. It depends on how much the family is willing to do that. But if they're that dangerous, then that might be one alternative. The easiest way, obviously, is to get the person to voluntarily participate in some kind of evaluation.
Anna, go ahead with your question.
Okay, I'm so scared of snakes that I can't even lay my hand on a paper snake. or I can't stand to see wooden snakes or anything that looks like a snake. Is there anything that I can do to...
Okay, you have a specific phobia, and it is treatable. And it is treatable through psychological treatment. It's not, medications are not necessary. It is a specific type of anxiety, and the way it is treated is through what we call slow desensitization. It's a slow exposure. But before you can do that, you have to learn where the fear is coming from. But it is treatable. It just takes a lot of time to get rid of that fear.
Okay, Dr. Lotto, thanks so much. I know a lot of our viewers have very candid and personal questions, and we certainly appreciate you calling in those questions. And thanks so much for joining us today.
Okay,
appreciate it. Well, it's strange but true. One of the most common ailments suffered by senior citizens is dehydration. We'll tell you why, and we'll have some tips on avoiding it now.